Hello, good morning to all of you. Thank you, Professor Aldaberto, for the invitation. It's a real great honor to be present and to attend this meeting. And my challenge now is, in a few minutes, to present to you the French healthcare system. So it will be a real deal in order for you to understand that at the end, in the hospitalization healthcare, the system in France is based upon full cooperation and collaboration between public and private hospitalization. And after, I will take some time to introduce Vivalto Santé, not to speak in detail about the company, but to speak about the items that I consider that could be of interest for the attendees here. Two differentiators in our market that makes us, I think, even stronger. So I've lost, no, I'm not, is it the right one? Yes. So to start with, is it possible to have the presentation here? No? On the screen? Anyway, I will look at it, anyway. So in a few figures, if you take some hindsight, the amount of spending we had in France is above 10% of the GDP. If you compare it to Portugal, it means that we are 3 points above the spending on average that you have. So we can hear that with the World Health Organization, the French system is one of the best in Europe, but it's also one which is the most expensive. And according to what has been said before, with the trends of the spending and the trend of the revenues from the states, you can imagine that we will face a strong hurdle in the future due to the level of spending we have already. So we are, like everywhere, in a system where we have to reform. This spending is split into various, so it's 254 billion euros a year. The figures are for 2024. And what you can see is that the blue part, which is the main spending, is what we call soins de ville. 43% is for doctors. So it's the GPs, it's the primary care in France. Then you have two colors, one in gold and one in light blue. And the combined is for private and public hospitalization, which accounts also for 41%. It's a big budget. I will enter in detail just after. And then you have other spending, some which are for nursing homes, 7%. You have the what is about physiotherapy and disabled people, which is 6%, and then others. If we focus on the healthcare facilities, public and private hospitalization amounts for 105 billion euros. And the 105 billion euros, in terms of split, it means 1/3 for private and 2/3 for public in terms of level of activities. But when you look at the cost side for the community, it is 18% only for private, where it is more than 80% for public hospital. It is due to the fact that when the French government introduced a universal DRG system in France, they started the system with an initial gap of 20%, which means that for the same pathologies, private sectors is paid 20% below public hospitalization. Which means, in a way, that there is efficiency to drive patients to private hospitalization in France compared to public hospitalization. And last year, at the end of 2023, there was over-execution of the budget in the private system compared to public that were under execution. And we are with a deficit of 3.5 million stays, which is called the COVID debt, which is still at the end of 2023, which means a lot of to work on. and the dynamic of the private hospitalization allows to reduce a little bit of this debt. Among that, because it was on the efficiency side, if you look at the content of what is handled by private, 55% of the surgery is done by private hospitalization in France. And then you have all the figures. You have, in terms of physiotherapy, re-education, it's 42. In mental health, it's 22. In home care, 20%. 75% of ambulatory services. 40% in oncology, in cancer treatment, not only in surgery, but in radiotherapy, chemotherapy. So here you have also the demonstration that, notwithstanding what we can hear sometimes, private hospitalization is not only handling low cases, easy cases. There is no selection of patients in the system. The selection is not at that level. The selection is due to the regulation and where the states allows or not private hospitalization to make intervention. For example, in the emergency units, there is a huge constraint for authorization. That's why we only have 122 emergency units in private hospitalization in France, where we have 1,000 hospitals that could have, for some of them, permanent 24/7 emergency units for the community. Another example is the ICU. So intensive care is highly regulated, and when you have a regulation on intensive care where you cannot have access to this, you can imagine that after that, you have to select, in a way, the level of gravity and severity of your patient, because you should have some intensive care for some of the operations. So I reassure you, a lot of hospitals in France have intensive care, but not with the same proportion as our market share. This one, I go not through it because it's too much detail. Perhaps to finish with the French healthcare system, it is just a map of the two first groups in France in terms of where they are located in the territories. As you can see, we are everywhere, which means that the system is really depending upon a strong private hospitalization system. 4 patients out of 5, which means 80% of French citizens are at less than 30 minutes of an private institution. So we are clearly a key actor for the continuity of cares for our people. Among the private hospitalization, Vivalto Santé is playing, I would say, a kind of specific role and having a specific status. So just in one map, and that will be the only slide with some advertising on the company, you can see that we have been created in 2009, so 15 years ago. So we are a very young company, built upon 3 hospitals in Brittany. And today, at the end of 2023, we are a European company, number 7 in Europe. And we are very, very proud to be present because, as you can see, we are with a huge presence in the Iberica Peninsula through Ribera Salud and Luciadas, and also in Central Europe, thanks to Ribera's subsidiaries in Central Europe from historical reasons. We are also in Switzerland through CIC. These are the figures, so I will not enter in too much detail. What you have to retain is around 30,000 people taking employees and physicians in this company, in all the subsidiaries for more than 100 private hospitals. What is interesting now is to speak about our differentiators. For Vivalto Santé, there are 2 strong differentiators that I think could be from inspiration when you speak about reform. The first one, and it is in our DNA, we are strongly committed with CSR topics about sustainable development, social, societal, and environmental topics. We've decided to become a B Corp in France, which is called Entreprise à Mission. This is a law that has been in 2019, which is la loi Pacte. And Entreprise à Mission means that you are including your raison d'être in your bylaws, which means that it's not only having an ambition, it's having a commitment towards the community on several topics. It's having governance, an organization, and at the end, you have an independent auditor that comes and make an audit to check that what you've promised to do is delivered. And behind the 4 core statutory objectives, which are very easy to understand, each objectives are around the 4 stakeholders of our company. Patients, it's about patient experience. Doctors that are key in order to deliver the right outcome for the patients. Our people, we had a conference this morning that showed that the people are at the core of the system. It's clear that for us it's also obvious. And last but not least, the planet, because we cannot live in a world where there is no future. So here, behind that, there are more than 20 very operational, concrete objectives taken for 2024 and for 2030 in order to have a longer vision of what could be the commitment of Vivalto Santé. This is a key element of attractiveness of our company, not only for nurses, but also for doctors. And we have a lot of advantages in our relationships with the legal authorities, with the healthcare authorities, with the politicians, due to our statute of entreprise à mission. The second difference, which is what we call the third way, is about our relationships with doctors. Doctors are not only a key partner in the business and medical business model development, they are also shareholders. They have 30% of Vivalto Santé. They are members of the supervisory board. They have 5 seats out of 11 with veto rights, which means that there is no decision that could be taken at Vivalto Santé without the consent of our doctors. And this model is hybrid. It's quite exceptional. You don't have it elsewhere, at least in France. I don't think we find it in Spain and in Portugal. This is clearly a model we want to develop, and we are working with the team of Vasco from Luciadas to see how we can introduce this system in Portugal, because this is a system that makes sense. And behind the fact to be shareholder or to be part of the governments, what is really important is that the doctors, they are involved in all stratification of the company. We have specific committees at the level of the hospitals. We have specific committees at the territory level, which could be in a way close to your ULS structure in Portugal. This is the dimension of it. And we have also relationships at the top of the company. And as you can see, there is a correspondence with the total executive. The CMS is about strategy. Here you have some example of the kind of work we can do with a strategic medical committee. It's about how to have a kind of certification of our medical teams, to have good practices, good protocols. And you can imagine that it is not something we can do by ourselves. It's the work done by doctors. Doctors are defining what are the best conditions to have this kind of certification. We're working on innovation with my 2.0 consultation, which is a way to see how to preserve resources, because doctors' resources are scarce in France like everywhere. And it's very important to see how artificial intelligence can help to drive the patients as best as possible before they enter in the consultation phase. We are working on the robotic strategy in orthopedics. We are also working in the numerization relation to have people staying at home. Like Alberto De Rosa said before, we are convinced that a big part of the medicine will be at home tomorrow. And we have to empty our institution, because we cannot sustain and we cannot continue to invest billions and billions in institutions. We have to work differently and we have to be disruptive in that field. And then it's also about internationalization. On the operational point of view, we also have a different set of doctors that are helping us having a broad vision of what we can do to help the company in several fields. For example, when we work about purchasing, how to improve the purchasing power of the company, or when we speak about the shareholding in other countries. So all these ideas, I think, could be of inspiration for public hospital because they have a lot of difficulties to merge the two words of managers and doctors. So these could be ideas, and we are presently working with the French healthcare authorities to see what can be taken from this model to develop. I will stay the whole day here, so I will have great pleasure to answer your questions during the what we call networking sessions, and then I will leave now for having the debate with my peers. Thank you very much for your attention.